Are you planning to go for same day surgery interviews? Are you planning to write CPC certification exam? Are you planning to clear same day surgery coding? So if the answer is yes for all these questions, this is the video you need to watch completely in order to learn surgery concepts. My name is Harish Gupta, medical coder, ambulatory surgery process trainer, content creator for Fast Coder 21 free medical coding channel. If you are visiting it for the first time, please click on subscribe button to receive future updates. So today our topic is CPT nervous system common interview Q&A part 1. So today onwards I am going to publish weekly or monthly part by part series. So today we are going to learn CPT nervous system common interview Q&A part 1. If you like this session, please click on like button to motivate me and also try to learn as much as possible. If you have any complexity understanding, please mention in the comment section of this video. So first question is hematoma. So what is hematoma basically? So hematoma is the collection of blood in the surface of the brain. As now we are learning nervous system, most of the anatomy you need to remember here related to nervous system. So here first we are having hematoma, a collection of blood on the surface of the brain. So if the patient is having any type of blood collection on the brain, we will call it as hematoma. Hema means blood. So whenever you learn anatomy for learning surgery, you need to have good understanding of prefix and suffix. On my channel, you will find number of videos related to CPC and CPT. In order to gain more knowledge, please watch those videos. So next one is subdural. So beneath the dura, the outermost membrane covering the brain and spinal cord. So basically, so whenever we understand this one, subdural. Here prefix sub means under. So dural. Dura is the matter, or usually we'll call it as dura matter. So subdural means below the dura. So if you go to interviews, they will ask you, or if you want to write CPC exam, they will ask you. So what is subdural? So here subdural means beneath the dura, the outermost membrane covering the brain and spinal cord. So as soon as you see dura, you need to understand that physician is speaking about dura matter. So next one is twist drill. Handheld and manually operated drill with one or more deep spiral grooves that extended from the point to the smooth part of the shaft. So twist drill, this is the common procedure in same day surgery coding. So as soon as you see twist drill, you need to understand that this is a handheld and manually operated drill. So in order to make or create openings, physician will use this twist drill during the same day surgery as well as during the brain surgery. So next one is ventricles. So chambers in the brain filled with cerebrospinal fluid. So usually we will call it them as CSF. So CSF fluid is the present in the chambers in the brain. So which we these chambers we will usually call it as ventricles. So next one is the ventricles already we have seen. So here one most important thing you need to remember that ventricles presents in the heart and brain. So based on the scenario you need to understand. So if the physician mentions CSF fluid along with ventricles, you need to remember this is related to brain. So next one is ventricular puncture. To the piercing of a cerebral ventricle with a needle to withdraw fluid or administered medication or other substance. So whenever you see ventricular puncture, you need to remember that in order to remove the cerebrospinal fluid, physician will pierce the brain ventricle. So this ventricular puncture will not be performed on the ventricle of the heart. So whenever you see this ventricular puncture, as soon as you see, you need to remember that physician is performing procedure on the brain. So the purpose of this one is so piercing the cerebral ventricle in order to administer medication or other type of substance. Next one is burr hole. So hole drilled into the skull using a burr drill, also called trepanation or trephination. So basically here also based on the scenario, based on the surgery, physician will create one hole in the brain. So in order to create that brain, physician will use burr hole drill. So next one is ventricular. So refers to the cerebral ventricle. Just now we have seen a largest and uppermost section of the brain divided into left and right cerebral hemispheres. So as soon as you see in the brain section or nervous system section, you need to remember ventricular is the uppermost section of the brain and it is divided into left and right cerebral hemispheres. Hemi means half. Spheres means this is the shape of the ventricle. So next one is craniectomy. So as soon as you see this one, you need to understand prefix and suffix. So here prefix is crania, ectomy is the removal. So here removal of the skull. So surgical procedure where the provider permanently remove a piece of the skull or brain flap to access inside the cranium. So here craniectomy means related to brain, ectomy means removal. So here physician will remove the piece of the skull in order to perform procedure on the cranium. Next one is craniotomy. So this is the anatomical location for craniotomy is same as like craniectomy. So previous one in craniectomy, physician will remove the part of the skull, but here physician will not remove anything. Just he will perform the incision on the cranium. See here, surgical procedure where the provider removes a piece of the skull or brain flap used to access the inside of the cranium and returns the patient's skull in its normal position prior to closure. So next one is catheter, a flexible or rigid hollow tube placed into the body for administration of medication or fluids or to remove a fluid or to keep a passage open. So this catheter is the common word for all same day surgery coding. So whenever you see the catheter, you need to remember this is a flexible or rigid hollow tube placed into the body for administration of medication. So next one is chemotherapy agent. So drugs used for cancer treatment also known as cytotoxic agent. So if you go to the interview, they will ask you what is chemotherapy agent. So chemo means drugs, therapy means treatment. So using the drugs, physician will perform the treatment here. So chemotherapy agent means drugs used for cancer treatment. So most of the time, whenever you see chemotherapy, you need to remember that this type of therapy will be used for cancer treatment only. So next one is intracavitary within an organ or body cavity. So as all of us know, we are having number of cavities in our body system. So whenever you see cavitary, you need to remember that within a organ or body cavity. So intra means within or inside. So inside the body cavity. So next is resection. Surgical incision of all or part of an organ, tissue or structure. So resection is the surgical incision or excision of part of an organ or total organ. Next one is craniosynostosis. So a congenital condition causing premature fusion of cranial sutures in young children. So basically sutures are the organs which presents in the human brain. Next one is decompression, a procedure to remove pressure on a structure. So this is also very common procedure in the spinal procedures. So whenever you go to interview, they will ask you what is decompression, a procedure to remove pressure on a structure. So in order to remove pressure on any type of structure, physician will perform the decompression. So compression means here you need to divide this word. D means removal. Compression means pressure. So removal of pressure is decompression. Next one is extracranial. So extra means outside. Cranial means skull. So extracranial means outside the skull. So next one is intracranial, within the skull or in the brain. So extra means outside, intra means inside. So extracranial means outside the skull, intracranial means within the or inside the skull or brain. So next one is fibrous dysplasia, a condition of the bone where a bone develops abnormally and scar-like tissue develops in place of normal healthy bone. So here basically replacement of the bone tissue. So here normal bone will not present and a condition of bone where a bone develops abnormally and scar-like tissue develop in place of healthy bone. So that we will call it as fibrous dysplasia. So next one is how does the surgery of skull base categorized? So whenever you want to code skull base surgeries, we need to remember three approaches or three steps. First one is approach. So how does the physician will get exposure to the lesion? or any type of pathologic entity. So next one is the definitive procedure. So necessary to biopsy, excise, otherwise treat the lesion. So definitive procedure means surgical procedure which is necessary to reduce or remove the patient's abnormality. Next one is repair or reconstruction of the defect present following the definitive procedure. So as soon as physician perform definitive procedure, physician will need to repair the defect after the definitive procedure. That one we need to understand. So if you want to code for skull base surgery, we are having three steps. First, you need to identify approach procedure. Next one is definitive procedure. Next one is repair and reconstruction. So next one is how do you code if multiple surgeons perform multiple procedures. So if multiple surgeons performs multiple procedure, we need to code individually. So here we need to understand if surgeons perform multiple procedures, we need to check what are the specialties present during that procedure and we need to code for each and every surgeon. So this is based on the client. We need to follow the client guidelines coding these type of procedures. So how do you code if same surgeon perform multiple procedure? So if the same surgeon performs multiple procedures, we need to code each and every procedure with modifier 51. So this one is multiple procedure, multiple surgeons. So this one is single surgeon, multiple procedure. So if the same surgeon performs multiple procedure, if you are working for physician, you need to append 51 modifier. Next one is what is extradural. So present inside the skull but outside the dura mater, which is the thick outermost membrane covering the brain. So next one is intradural. Within the dura, the tough outermost membrane surrounding the central nervous system. So extradural means outside the dura, intradural means inside the dura. So thank you friends, thanks for visiting FastCoder 21. So if you have any difficulty understanding this video, please mention in the comment section of this video and also please watch and encourage your friends to subscribe to our channel. So we will provide same day surgery, CPC and CPMA training. So if anyone is looking for these trainings, please contact us. So if you have any difficulty, please write your feedback to vincentmedicalcoder@gmail.com.